We have a quorum here, I believe. Clerk, call the roll.
Senator Suderline, Senator Donovan, Senator Barker,
Barker's here.
Senator Saslaw,
Here.
Senator Peterson.
Here.
You have a quorum, Mr. Chairman.
Okay, wonderful. All right. As you may have noticed, there's been a coup d'etat, and I took over from Senator Lewis. I claim no extraordinary knowledge in this subject matter, so I appreciate witnesses being comprehensive and educating me on these issues. And looks like we have a sign-up ahead of time, and we're going to start with the esteemed professor, otherwise known as Senator Locke. Retired professor. Okay, Senate Bill 439.
There's a substitute.
Okay, can you distribute the substitute, please? Thank you. Senator, what do we have?
Okay, thank you, Mr. Chairman. What the substitute does is makes this a little less cumbersome, and the most important parts are lines 21 through 26, which makes it simply a notification bill that in cases of a pregnant incarcerated individual, the Department of Corrections will identify people who are in the custody of a correctional facility, and if that person is currently enrolled in the Commonwealth's program of medical assistance or who may be eligible for services under the state plan for medical assistance, and they will ensure that that person is released on a medical furlough for the purpose of giving birth or other pregnancy-related care and understand the steps that are necessary to receive Medicaid. That's what it does.
Okay, all right, so basically just giving assistance to pregnant women in DOC.
And notifying them that they may be eligible for Medicaid.
Okay, wonderful. Do we have any people here to testify in favor of Senate Bill 1439? Come forward. Hey, Siobhan. Go ahead. Yes, ma'am.
Good afternoon, Chair and members. My name is Sequoia Phipps-Hawkins, and I'm the Director of Communications and Marketing for Birth and Color RVA. I'm also a Virginia State Certified Community-Based Doula. As a doula, thank you. As a doula, I've seen firsthand the immense need for adequate support during pregnancy and birth that our communities have. Our organization and our director, Kenda Sutton-L, specifically have met and interacted with people during the postpartum period and beyond who have previously been incarcerated during pregnancy. They've shared their stories with us and their burden, the burden they unknowingly took upon themselves by taking medical furlough in order to birth their babies because they were not made aware of their right to access emergency Medicaid coverage during medical furlough. This oversight leaves new mothers and parents with medical bills that they are faced with immediately when they are no longer incarcerated. This means that a parent who is re-entering the community may simultaneously be finding a job, acclimating to parenthood of a newborn, and figuring out how to pay these medical bills they did not know they acquired during furlough. On behalf of nearly 100 birth workers who make up the Birth and Color Doula Collective and our organization as a whole, we ask that you support this bill so that it is required and ensured that pregnant persons on medical furlough are informed of their right to Medicaid coverage during that furlough.
Okay, very good. Any questions? Okay, anyone else? Thank you. Thank you for appearing. Anyone else here to speak for the bill? Anyone opposed to the bill? Oh, you're fine. I think you're probably in good shape. All right, let me ask, is anyone here opposed to the bill? All right.
To recommend reporting.
All right, we move motion to recommend reporting. I'll second that. And the substitute, right, okay. So move to recommend reporting the substitute. I second that. Barker, you're good with this, right? Yeah. Okay, all right. All in favor say aye. 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 Saslaw. Okay. Unanimous. Okay. That reports. Thank you. All right. Mr. Deeds.
Yeah, I've got Senate Bill 1302. There's a substitute for this.
Okay, 1302.
I'd ask you to adopt the substitute.
So moved.
During this past summer, I worked with students from UVA School Hall, state and local government policy clinic, the student Claire Aspen, Michael Ferguson, and Professor Andy Block, specifically on behavioral health reform. We worked for some time to address we worked in this body for some time to address the underutilization of medical TDOs for intoxicated patients. This is a way to prevent the unnecessary transfer of intoxicated individuals to state facilities. I'd like to invite Michael Ferguson, one of the students, to come up and tell you exactly what this bill does.
Okay. Michael, come on up. You're a student at UVA Law?
Yes, sir.
That's too bad. I graduated there in 94. Okay. Tell us about this bill.
Thank you, Mr. Chair and members of the subcommittee. So as Senator Deeds discussed, my name is Michael Ferguson. I'm a law student with the State and Local Government Policy Clinic, and our team has had the privilege of working with Senator Deeds on the development of this bill. The views I express today are my own, not those of the law school or the university.
Okay.
Senate Bill 32 makes it easier for hospitals to admit patients under a temporary detention order who are already held in emergency rooms because their intoxication makes them unable to consent to treatment and is causing them to be a danger to themselves or to others. To do so, it builds on Senate Bill 738, passed in 2020, by making it easier for physicians to obtain medical TDOs. Specifically, it modifies the current law to allow doctors to obtain medical TDOs from either circuit court judges or magistrates from the beginning. As you well know, overcrowding in psychiatric facilities has been a significant problem in the Commonwealth for years, with facilities frequently forced to operate at or above 100% bed utilization and staffing levels as low as 60 to 70%.
Okay.
Medical TDOs for intoxicated individuals, if more fully utilized, offer a way to help address this problem by diverting patients who do not need to be there. For context, while not all of these patients would be eligible, DBHDS estimated in 2019 that 30% of patients admitted to psychiatric facilities were intoxicated during their pre-screening evaluation.
Now, when you say intoxicated, is that just alcohol or alcohol and drugs?
That is alcohol and drugs.
Okay. All right.
Additionally, SB 1302 will reduce the burden on law enforcement officers as custody transfers from them to the hospital upon issuance of medical TDOs. And most importantly, SB 1302 will improve hospitals' ability to care for intoxicated patients by allowing them to be admitted into the hospital itself rather than being stuck in an emergency room awaiting transfer to a psychiatric facility. For all these reasons, I urge you to vote for SB 1302.
Great.
Mr. Chair.
Senator Deeds.
The administration supports this bill. We've worked with the emergency room physicians pretty extensively to try to get the nuances right. There are lots of people here to answer questions and speak to them.
All right, let me start with this. Is there anyone in opposition to the bill, particularly in the medical community? I don't see any hands going up. Okay, any questions from the panel? Okay, if you're in favor of the bill, just raise your hand. Okay, I see people there. Okay, I think you're probably going to be okay. All right, Chair will entertain a motion.
Move to recommend reporting.
Okay, of the substitute.
Of the substitute.
And we've adopted the substitute. All right.
Correct. Mr. Chair, this is identical to SB 808, which is Senator Favola's bill. I just want to let you know.
Has that already passed, or?
No, it's on the docket today. So you can incorporate.
Okay. How do you want to roll it in?
You know, I'm,
Do you need this?
young people worked on this bill a good bit.
All right, why don't we roll her 808 into 1302, and we'll make you all chief co-patrons.
Yeah, chief
All right, do I have a motion and a second to roll 808 into 1302, and you all be listed as chief co-patrons?
Thank you.
All right.
Awesome.
All in favor, say aye.
Aye.
Okay, now we have a motion to report the rolled into and a substitute bill. Motion and a second. All in favor, say aye.
Aye.
Any opposed? Sasslaw votes aye. Right? All right, okay, we're done. All right, next, Senator Newman.
Mr. Chairman, good afternoon.
Sir, talk to us.
Famous last words. I hope this is simple. There is a substitute.
Strong work team
Okay.
on the substitutes.
Okay.
Right.
Okay, do I have a motion and a second to adopt the substitute?
So moved.
Okay. All right, all in favor, say aye. Aye. All right, the substitute is in front of us for Senate Bill 872.
That's right.
Okay.
Mr. Chairman, this is Senate Bill 872, and the substitute, it does just two things. Last year, we authorized the department to go out and look at the TDO and ECO and look at best practices. You're going to see more of their things coming forward. This is one of those items that was discussed. It basically is just two components. If you want to go to line 38 in the substitute, you will see that for the last many years, the magistrate or the court shall consider any request to, and the recommendation is just to say that they shall authorize the transportation of alternative systems. So it takes it to the authorization takes it to a done effect. That change is also on 168, just because this bill is broken into two sections, TDO and ECO. The next is on line 145. Mr. Chairman, and on line 145, it does authorize certain alternative transportation services, a certain amount of restraint capability, and I'm going to go through kind of what those are. Mr. Chairman, maintaining custody and providing transportation services for TDO and ECO is just causing huge restraint. I don't think I need to tell this subcommittee that, but law enforcement has been buckling. This keeps a lot of officers off the street. If you ever need an example, I'll tell you one of Lynchburg going from 11 officers for 11 square miles to 3 one night, and the rest were with people who needed help. And that's the type of thing that we're seeing. So this group was looking for alternatives. The bill does require the magistrate to authorize the alternative transportation. In general, they do. Some have been a bit confused about this. There are a couple of standards that must be met. One, the provider is available and they're willing, and they determine that it can be done safely. Also, the alternative transportation types that are available is a family member. I mean, sometimes clearly a family member is willing, able, and capable of doing it, and they can do it. The other is a willing, capable, and able friend. Also, the CSB or their representative, and DBHDS, which has the ability, of course, to contract with the alternative transportation networks. But they can only do it if those authorizations are met. Let me talk to you a little bit about that kind of Section 2 in the bill that clarifies that alternative transportation providers under contract, and only those that are under contract and have an agreement with DBHDS, may use the restraints that are mentioned in the bill. And if certain conditions are met, and they're called compassionate restraints, and those are kind of outlined, we can go through those. Clearly, law enforcement is oftentimes not available today to do their restraints, and many in mental health crisis fall under this category. Couple of items that are out there, conditions that must be met for restraint. First, once again, they must be under this extensive contract with DBHDS. Second, they must complete the DBHDS training program, and the restraint is considered to be necessary for safety of the person or for others. And also, it has to be deemed to be less restrictive alternatives determined to be less restrictive alternatives are determined to be ineffective. So, Mr. Chairman, basically it does two things. It says that when a alternative transportation is available, it may not be the right thing. The sheriffs or others may not decide to do that, but it's going to be authorized. And two, it says if there is any restraint that takes place, how it's going to be done.
Okay, all right. So basically, this bill has to do with transportation of folks under a TDO or
ECO.
Or an ECO.
That's right.
And how they can be restrained and who can transport them. Okay. Anyone here to testify in favor of this bill? Anyone here in opposition? Come on forward. Yes, ma'am.
Elizabeth Hobbs with the Virginia Sheriff's Association, and we support the bill. I'm happy to speak on it, but I think the Senator's got it.
I think that was a good explanation. All right, thank you. That was the sheriff's. Anyone in opposition? Go ahead.
Jennifer Wicker with the Virginia Hospital and Healthcare Association, and we support the bill.
Okay, all right. Anyone else in support? Anyone in opposition to this bill? Okay, we have a motion to report. Second, we have a motion and a second to report the bill. All in favor, say aye.
Aye. As substituted.
As substituted. Okay, and we had adopted substitute. Okay, that bill reports unanimously. Very good. All right, next I have Senator Lewis on my sign-up. I see Senator Rouse has been here also. Let me get him out so I can get him back to Ag before Stewart blows up the Commonwealth. So. I did.
He was trying to repeal Reggie when I left.
He's trying to repeal everything we did. All right. All right, go ahead.
Mr. Chairman, members of the subcommittee, I have Senate Bill 1457, and there is a substitute.
Okay, I have a motion and a second to adopt the substitute. All in favor, say aye. Aye. All right, we have the substitute in front of us.
So, Mr. Chairman, Senate Bill 1457 attempts to fix a defect in our Medicaid long-term services and support screenings in nursing homes in the Commonwealth, which has resulted in a denial of Medicaid benefits for certain patients. So right now, if a patient is taken to a nursing home for short-term rehab, this screening must be completed before that patient can be admitted if the patient is on Medicaid, if the patient has applied for Medicaid, if the patient indicates he's going to apply for Medicaid. If the patient meets those criteria and does not have the screening, and then they develop the need for long-term care after they've been admitted, they cannot access Medicaid benefits from the nursing home. So what this legislation does is allow the nursing home screening team to subsequently post-admission perform the LTSS screening that they should have had at the outset prior to their admission. If the lack of the screening was the fault of the nursing home facility, the patient will not be able to access Medicaid benefits for 6 months, but the nursing home facility will be responsible for that during that time period for the provision of care to the patient. So that's the bill, Mr. Chairman, and for anything in depth, Scott Johnson is here.
All right, Scott, you want to come forward and...
Thank you, Mr. Chairman. Scott Johnson, General Counsel for the Healthcare Association. The best way I can do it is an example. Grandma's in a hospital, needs to go to the nursing home. If grandma is on Medicaid, has applied for Medicaid, or says she is going to apply for Medicaid, she today is supposed to be screened by the hospital team. If we've had examples when the patients are actually transferred and come to the nursing home and the nursing home realizes, hey, one of those three things happened and she wasn't screened. The law today is two. One, grandma cannot access her Medicaid benefits, and two, the nursing home is forced to care for her and not get paid for it.
Ooh.
So this fix basically would say under that scenario, grandma comes to the nursing home screening team screens her. If DMAS said you're qualified, grandma gets her benefits through DMAS, and the nursing home starts to get paid. As a safeguard, if the nursing home has any fault as to why that screening was not done at the hospital before transfer, the nursing home cannot be paid for 6 months. You don't want people running the table to say, hey, just admit them on over here and we'll do the screening. That's the bill.
Mr. Chairman, question.
Senator Donovan.
Scott, in what circumstance would that nursing home be responsible for the patient not being screened before they left the hospital?
Mr. Chairman, Senator Donovan, one of the most common examples is a son of grandma has applied for Medicaid and did not tell her. So when she's in the hospital, they say, Ms. Smith, are you on Medicaid? No. Have you applied? No. Do you intend to? No. And then once she gets to the nursing home, the son is there, and the son says, well, I applied for Medicaid last week, and I didn't tell her because I didn't want to upset her. So it's an innocent example is one example, and sometimes things just fall through the cracks.
But how is the nursing home responsible for the hospital not, Mr. Chairman, sorry.
Go ahead.
For the hospital not completing the screening? How is that? That sounds like the son's responsibility.
Mr. Chairman, Senator Donovan, what happens today is the screening is supposed to be done at the hospital before she comes to the nursing home. Sometimes the nursing home is not aware that the screening at the hospital did not occur. And so this gives a pathway to fix that void.
Okay, so if they miss the initial screening, they do it, and then does it make it retroactive, or what? It's a 6 months?
Mr. Chairman, when the screening is done by the nursing home screening team, the payment starts when DMAS says that the person is eligible for the LTSS benefits.
And so who's responsible in that gap then?
The gap, the nursing home's got to eat it, as they do today. You got to be screened to get your benefits. If you're not screened, you don't get benefits.
So, okay. So how is this changing the existing law?
The law today says when grandma comes to the nursing home, she gets no benefits from Medicaid, and the nursing home has to take care of her as long as she's there and not get paid a penny. This will say she comes to the nursing home screens her, DMAS says she's entitled to these benefits, she starts getting benefits from
the
DMAS.
time they designate.
Yes, sir, and the nursing home cares and gets reimbursed.
Okay.
And I want to thank DMAS. We worked with them on all the technical amendments on this.
All right. Is someone here from DMAS, Department of Medical Assistance? Come on forward, sir. Yeah. And this is on Senate Bill 1457. Yes, sir.
Mr. Chairman, members of the committee, my name is Brian McCormick. I'm the Director for Legislative and Intergovernmental Affairs at DMAS. Happy to answer any questions.
Well, I guess let's start with, do you favor this bill?
We have no position on this bill, but we worked many hours with Scott Johnson and his colleagues to come to a good place on this bill.
All right, well, silence equals assent in this building, so if you're not opposed to it, that means you're okay with it. Acquiescence. Any questions for DMAS?
No, sir.
Okay, so basically, for those of y'all listening at home, what this bill does is it provides a mechanism to enroll somebody in DMAS, put them on Medicaid, if for some reason they weren't initially screened when they went into the institution. Did I describe that correctly? All right, I got it. Okay, thank you. All right, any other questions? Anyone here opposed to this bill? All right. All right, we have a motion to recommend reporting of the substitute. I have a second. All in favor say aye. Aye. Any opposed? Aye for Sasla. Okay, we've been very easy on people. Senator Rouse, come forward.
Don't let that stop.
And we're not stopping. Okay. Yes, sir.
Thank you, Mr. Chairman.
Yep.
I present a bill, Senate Bill number 1544. What this bill does is aim to release administrative burden and reporting. The Department of Behavioral Health and Development Services currently requires reporting of serious incidents and DD waiver group, development disability group, homesteading within 24 hours of the incident. This bill will simply allow providers to report incidents the next business day.
Okay, so this is Senate bill. Was it 1544?
Yes, sir, 1544.
Do we have a substitute or it's just as is? Okay.
Sorry.
Okay, so we have Senate Bill 1544, and it's been described to the senator as essentially incident reports can be done the next business day as opposed to the next day. And it was initially Senator Lucas's, and do we need to roll Lucas into Rouse?
I think so.
All right, we'll have a motion to roll Senator Lucas's bill into Senator Rouse's. Do I have a second? All right, we have a second, motion and a second to roll 1177 into 1544. All in favor say aye.
Aye.
Aye. Okay. So you and Senator Lucas will be the chief co-patrons of the new Senate Bill 1544, and it's identical?
Yes.
Okay. All right. So basically 1544 has to do with the reporting of next business day as opposed to next 24 hours for incidents at what kind of home?
The Department of Behavioral Services.
Oh, DBHDS.
Yeah.
Okay. All right. All right. Is there anyone testify in favor of the bill? Come forward.
Sir.
Yes.
Thank you, Mr. Chairman.
Of course.
Good afternoon, Mr. Chairman, members. Karen Addison with Troutman Pepper Strategies. We thank Senator Rouse for putting this in for us. The Loudoun County requested this language. We've run into a little bit of a snag after hearing that there is some concern that this might run afoul of the Department of Justice settlement. So we wanted to bring forward some of the concerns about administrative burden that's being placed on providers because of the current law or the current regulations. But I think the right next step for us is to offer a substitute, which would be a study, to have the department review the regulations and come up with a list of recommendations in conjunction with stakeholders.
Okay.
And that would allow us to see some of the things that we could possibly do that would not run afoul of the Department of Justice.
Well, why don't we just, okay, let me ask staff, can we convert this to a study? Or can we, how do we handle that?
Mr. Chair, we can turn this into just a Section 1 work group
There we
asking the
go.
department to study.
All right, why don't we convert this into a Section 1?
I've got copies if you'd like to see the,
Well, let me see.
proposed language. Yes, sir.
Okay, so my colleague here has handed me basically a language to be a Section 1 bill saying DBHDS shall review its regulations which require providers licensed to report allegations of abuse, neglect, and exploitations classified as Level 2 and Level 3. The department shall work with stakeholders to develop solutions to reduce administrative burdens on licensed providers and shall report the recommendations to chairs of Senate Ed and Health and HWI on November 1, 2023. All right, so we would. All right, so we move in a second to adopt the substitute, which is a Section 1 bill that I just described. All in favor, say aye. Aye. All right, the substitute's in favor of us. Is anyone here from DBHDS? Okay, you're good with this, right?
Yes.
Okay, sit back down. Thanks. All right. All right. Chair will entertain a motion.
Move to recommend reporting.
Move to recommend reporting as a substitute, as amended. All in favor, say aye.
Aye.
Aye. Okay, Sasslaw votes aye. All right, you're on your way.
Thank you, Mr.
Good
Chair.
work, Senator. Okay. Why don't you tell us for the record, what are the numbers of these bills and,
Okay. We got Senate Bill 1169,
okay, 1169?
Senate Bill
Thanks.
1170,
1170,
Senate Bill 1465.
14,
And 1465. And I've been out of the loop a little bit as some conversations were ongoing today. Some of the issues I think have been fixed. I know the sheriff had a small issue which we can fix. We've got some language for that.
Yep.
And I don't know if anybody wants to speak or you want to hear anybody right at this moment. But
Well, if we're not going to hear them today, I'm getting surrounded by proxies. If I'm not going to hear them today, why don't we just, is there any witness that cannot come back next week and you're here and you want to speak? Because I don't want to inconvenience you.
might save your time a lot if we get our
That's
heads
right.
together, particularly with Senator, Commissioner Nelson.
Yeah.
And see where they're.
All right, why don't we do that? You huddle up with, is it DBHDS, or huddle up with them and see if you can work this out. And like I said, if you're here today, you can't come back next week and you want to say something, now's your time. Otherwise, we'll see you next week. Okay. Very good. Thank you, Senator. Okay, I see Senator Hashmi. What do you have?
SB 1432.
Okay, SB 1432, and it looks like, do you have a substitute? Small amendment. All right.
But, Mr. Chairman,
ma'am.
starting yesterday and all day today, we started hearing concerns from several stakeholders who don't like the bill. And we, this is data privacy, 1432. And we have heard some good and valid concerns from some individuals. From some of our stakeholders that I think we need to hear further from and work with. I just understand you're going to have another meeting next week, and I would be happy to work with those individuals who have expressed concerns and see if we might be able to bring a resolution to some of their issues.
Okay. I guess I'll make the same offer that I did before. I appreciate your taking the time to maybe work things out. If someone's here and will not be able to come back and you want to say a piece, go ahead. Otherwise, we'll see you all next week. Okay. Thank you, Senator.
Thank you.
Okay. Do we have any other sponsors? I don't see anybody else. Siobhan or Dave?
I got nothing.
Okay. Do we have any other business we need to transact?
We have Barker. We have Mark Barker's going.
Barker's bill will go by.
Yeah, Pillion.
I think McPillion's we're going to carry over.
Okay. And McClellan.
I don't see McClellan. Is she around?
Mason.
Monty's downstairs in Ag. Okay.
Mason's by for the day.
All right, we're going to have a lot of stuff next week, folks, so yikes, exactly.
And Favola. Did we do Favola?
I have her last, 808 and 820s. Oh, we rolled in, okay. What is 820?
Do you want me to text her?
All right, just briefly, what's that about?
Hospital emergency department security.
Oh, yeah, this is good.
Okay.
I'm sorry, 827. Oh, there it is.
All right, let me.
Somebody text me.
Okay, 827. Can someone reach out to Barbara, see if we can grab her up here? Okay, we're trying to reach Senator Favola on the hospital emergency. Okay. Okay. Yeah, let me just announce Barker's staffing bill is continued to next week. Pillion's bill is continued to next week. The only bill we have left on the docket is Favola. Is she on the way up here?
I was able to get in contact with her office.
You were?
I was not.
All right, we're going to give her about a minute and then we'll just adjourn.
Just tried calling him, but nobody answered.
All right, why don't we just do this? Okay, I'm going to make an executive decision. I got to get back to ag, and so I think we all got other places to be. We're going to adjourn, and whatever bills were not heard today will be heard next week. Okay? This committee's adjourned. What's that?